Welcome back. This is Susan Nienhaus. I am one of the CNA instructors here at Allied Health Career Training, and this is Unit 4, Meeting the Residents' Needs with Communication. In this unit, one of the things that we're going to be talking about is attitudes that promote communication. Well, with attitudes with promoting communication, of course, courtesy and respect. We should always keep in mind that the resident has the right to make decisions regarding their own care. And we also have to remember that this is their home. When residents move into a long-term care facility, the only thing that should change about them is their address. So, anytime that we go and visit a friend, we always knock on the door first. Before we don't just walk into their house. So we need to have the same respect when we are with our residents in their homes, in the facilities. We should always say please and thank you both to the resident and the staff. And when we're speaking to somebody, we should always, talk to the resident by using their name. Always knock prior to entering the resident's room. And then this is how I like to do it. I knock on the door. I say, nursing, this is Susan, your CNA today. How can I help you? Then I usually identify my resident by calling them by their name. Another thing about attitudes with promoting communication is keeping our emotions under control. This is really a big thing, and the reason why is because residents, they get to know you on a professional level, but they also start to really care about you, especially if you care for them for a long period of time. They get to know you. And so we really need to keep our emotions under control because we don't want them to know that we're upset. Say for instance, I'm worried this week because I really don't have enough money for gas to get to work by the end of the week. And so I'm kind of a little uptight about that. Well, I really want to keep that under wraps. And the reason why is they're going to be able to know that I'm upset. They're going to be able to feel that in the way that I promote myself. So keeping our emotions under control is a professional courtesy to them and to the visitors and to the staff. Now, I want to talk a little bit about showing empathy. Showing empathy is when we put ourselves in another person's place. And it's really good to put yourself into that state of mind. And the reason why, and you'll know more as we go through the rest of the units, that we need to know how our residents feel. And by saying this, I mean we need to know how it is to have someone come into our room, a total stranger, and then just start giving us personal care. We need to really show consideration and respect when we walk into a resident's room. Some of the actions in response to promoting effective communication is identifying ourselves. It's extremely important that the residents know who we are. Now, we always have our name tag, of course, up in the right-hand corner of our uniform, but we need to also verbally tell our residents who we are. And that's just out of respect. When you meet somebody, the first thing you do is you introduce yourself, correct? So we're going to introduce ourselves. And sometimes we might have to introduce ourselves more than once with people that have dementia or Alzheimer's. But we'll talk more about that later. We need to always provide an opportunity for the resident to express their concerns or maybe just verbally wanting to talk with us. And sometimes those residents need an extra time to do that because they lose their train of thought. And so sometimes they'll pause in between what they're saying. So be respectful and don't try to finish their sentences. Just give them that time to finish what they want to talk about. Observing nonverbal behaviors, that's not just for the residents, but it's also for ourselves. In observing the residents' nonverbal behaviors, Those behaviors non-verbally are so important because they're going to tell us a lot, especially for people that can't communicate with us verbally. They're going to show us by just looking at them, whether they're rubbing their shoulder or maybe their mouth, they're just opening and closing it because it's real dry. Or maybe they're just restless because they've been in that position too long. Over time, you're going to get really good about watching people's nonverbal response and then how to take care of them. Always listen carefully. That's important. Sometimes they're going to talk about things and they may be using their mom, or they may be even saying another resident, but what they really mean is themselves. So you got to be that detective. You've got to try to wean through what they're saying to get to the understanding of what they want. Always focus on the residents' concerns. Oh, that's so important. They're going to tell you things, and it might be because they're worried about them, and they're going to express that to you. Maybe it's because they have an appointment coming up, but they're not really sure the time. And so they're really worried because they want to be ready to go when they come to pick them up. So if that's what it is, you could probably take care of that by just going up and asking the nurse what time is their appointment, and then going back and communicating that with the resident. There's going to be times that you're going to have barriers to communication with residents. Some of these barriers could be maybe they're hard of hearing and they don't have their hearing aids in. Or maybe they have their hearing aids in and they're not turned on. It's always important to check the function of our hearing aids. Make sure they're in the ear correctly. Make sure they're turned on. Same thing visually. What about if they're wearing glasses but they're on the other side of the room and the resident can't reach them? Maybe those glasses are dirty. They can't even see you out of them. So maybe we need to clean them. Those are a couple things that we need to be aware of, is their visual and their hearing. Now, there's also barriers to communication from us. Well, what am I talking about? Well, what about our nonverbal signs? What are we telling them with our expressions? What is our body language saying to them? Are we looking at them directly in the eye? Are we facing them? Or do we have our hand on our shoulder? Also, how far are we standing away from the resident? Are they talking to us and we're standing on the other side of the room? That's not displaying that we are actively listening to them. So we need to make sure that we are in front of the resident, that we have good eye contact, and that the resident can see us, and that they have their hearing aids on and their glasses, and that way we can communicate correctly. Now let's talk a little bit more about identifying yourself. I'm going to give you an example of how I enter a resident's room. I knock on the door, and as I knock on the door, I say, "Nursing, this is Susan. I'm your CNA today. How are you, Mrs. Smith?" So what I did was I identified myself, I gave my job title, and then I identified my resident. So the next thing I'm going to do is I'm going to explain to the resident the care that I will be giving. And I think it's really important that you talk to them again. Make sure you're close up, that they can see you. You have good body contact with them. You're looking at them. And then you go ahead and tell them about the care that you're ready to give. Always make sure you listen. Give them enough time to communicate back. Because elderly people, like I said earlier, they lose their track of thought sometimes. Observe for their cues to make sure that they understand what you're saying. That's really important. Now, as far as observing residents' nonverbal behavior, again, you're going to be that detective. You're going to observe their nonverbal behavior while you're interacting with them, while you're helping them to get dressed, or helping them to take a bath, or changing them in their position. So when you change their position, did they moan or groan or say that hurts? Any of those kind of cues would let you know that maybe that person's in pain. So those are the things you would go back and talk to the nurse about. Ask the resident about. Again, watching your body posture and your position. You want to give them the body posture that shows them that you are listening actively. Watch your facial expressions. Sometimes this is a little hard with your facial expressions because sometimes there are odors that kind of take us by surprise and we don't realize our facial expression. But I want to tell you, the resident is looking at your face because maybe they had a very foul smelling BM. You know, they're embarrassed about this. This is not the way they want to have it. They don't want to be incontinent of BM, but you know what? That's where they are, and that's what's happening to them. So watching your facial expressions, because you don't want to embarrass them or humiliate them. Now, when they start to get where they're real restless or they're turning away, why are they doing that? Try to figure it out. Use those nonverbal cues and be that detective so that we can help them. Now, you should always give a touch. And by touch, I mean just gently touch them on their shoulder and then release. That's just kind of showing them that you care and that you're calm and that you're in control. Touch can be a great respond, but you don't want to do it so that you alert them. You don't want to do it where you scare them. So make sure that they see you eye to eye when you touch them. Some of the skills that you will learn, and you'll learn really well how to do some of these, is listening to the resident when they express their thoughts and their feelings. And when you do that, listen to the tone of their voice. Are they speaking really loud? Are they kind of really shy, that tells you about that person, maybe how they're feeling at that moment. But always look at the person when you're speaking to them. And if the TV is really, really loud or there's music really, really loud, you might need to turn down the TV. Or if the music's coming from outside the room, you might need to shut the room, so that that you have a good environment to communicate with the resident and there's not a lot of distractions. In some cultures, it is very disrespectful to look them in the eye. But when we talk about care plans later on in another unit, we will tell you where to go to find information like this. When the residents express their thoughts, we need to respect them. Those are their thoughts. They belong to them. And really all I can say is you need to respect them. Something else with communication is that you have to repeat and summarize or validate what that person said. That lets them know that you understood what they were trying to tell you. Focusing on the resident's concerns, understanding the resident's personal history and past behaviors are really important. And in the care plan, when we teach you about that, there's usually a little summary that tells you something about that resident's life. And when we take that care plan, we always try to make sure if there's anything that's real traumatic in their life, that really impacted them, that it's there. So we know what it was. For instance, what about this? What about if they had a fire in their house and maybe 2 of their grandchildren died? Well, wouldn't that be great to know? Because we don't really want to bring up grandchildren, and then they have to tell us this really sad story. So it's good to know some of the personal history about our residents. Don't criticize staff or other members of our team in front of the resident. That is really a bad habit to get into. We need to stay with a positive approach. Putting people down in front of other people is not promoting good communication. It's not showing a positive attitude. Being aware of residents' barriers to communication. Like we talked earlier, environmental distractions. Some of these nursing facilities, they are very busy in the daytime. There's people coming and going and walking up and down the hall and pushing carts. Then there's the housekeeping. They might be vacuuming, and then the phone's ringing, and then everybody has their own their own televisions. They also have their individual radios. So you might have, 4 or 5 different TV channels going on, and they could be kind of loud. And you can have music going, and it could be several different kinds. These can be big distractions when you're trying to communicate with a resident. So we need to control the environmental distractions. If they're out in the hallway and we're trying to communicate with them, maybe we need to take them to their room so they'll be able to better understand us. A lot of residents, too, have difficulty processing information. And the reason is this: they might have some confusion. As the residents get tired, their mental awareness kind of decreases. In the morning time, they may be just talkative, telling you about all kinds of things that have happened during their lifetime. And then you go back in the afternoon and you know what? They don't say a whole lot. But that's okay. And it's usually because they're tired. Aphasia is... the word aphasia means that they cannot express any language. They cannot really talk. And dysphagia is meaning that they have difficulty expressing speech. Usually, this is a disability that comes from a stroke or a cerebral vascular accident. And the abbreviation for that is CVA. Most people know it as a stroke, and we'll talk a little bit later about that. But the inability to understand and use communication, think about people that English isn't their primary language. There's going to be times that you're going to run across people that don't speak any English. Sometimes they know a few words, and so we really can't communicate with them very much. And sometimes that's hard. It was always hard for me when I worked in the hospital, and I had people that come into, especially the emergency room, and they were really sick. But they couldn't understand what I was saying. So I would have to get someone to come in there that was in their culture so that they can translate things. Sometimes that is something that we can use in the long-term care facility. However, sometimes it's not. So sometimes we use a picture board that has like the bathroom, a toilet, food. Maybe it shows somebody rubbing an arm for pain. So there's all kinds of different things that we can use. So be aware of environmental distractions. We also have to be aware of barriers, effective listening and communication for ourselves, what we experience. I know sometimes, when I'm trying to talk to somebody, maybe I'm thinking about other things and I'm really not focusing on what I'm really trying to say to that resident. And then all of a sudden I make no sense to them. So I have to really kind of get everything out of my mind and get it clear, so I can communicate effectively. Not understanding their culture or their lifestyle or their religious expressions, you're going to run across that because I think Wichita and just about every city has a diversity of cultures. We have all kinds of cultures in our society, and that's what makes us all who we are. So we need to understand some of those cultures, and in the care plan, sometimes there are some things that tell us about their culture that will better help us communicate with the resident. So just remember their inability to understand the language used for communication. It plays a big part in our care for our residents. So there are all kinds of different things that we can do to communicate with them. So some guidelines for good communication, like we said, courtesy and respect. Keep those emotions under control. Don't come in because you've had such a bad day and you got mad at your significant other or your kid, and you have to come in with a positive approach. Put yourself in their place. How would you want someone to greet you in the morning? Always identify yourself. Give the residents the opportunity to express themselves, and make sure you look at those nonverbal cues or behaviors. Listen carefully and focus on their concerns. And remember that we also have to watch our environment, not only for the resident, but for ourselves. When we have family and they come to visit, sometimes they can give us great suggestions and feedback about the resident. They know them best, right? They live with them all their life. Families are great to go in and talk about, things that, their family did. Maybe some things that the resident did that hasn't really shared with us. This is a great opportunity to learn more about our resident. And as we learn in the units to come, it's going to be even more helpful when we have to either redirect or distract a resident. Now, we got to talk a little bit about providing the resident's personal health information. Usually there's a person in the family that's assigned to get all information about their resident or their loved one. And because, some of these people come from large families. They could have 10 kids. Well, as a nurse, there's no way I can call all 10 of those kids to tell them that I have a new medication or the resident's going to get a chest x-ray. I mean, there's too much of my time. So one person is designated to get this information and then communicate it with the rest of the family. And some of those things that we would communicate to them would be, like I said, any medication changes, maybe a change in their condition, or a doctor's order for chest x-ray or new lab. Now, this information really needs to come from the nurse. The CNA can answer family questions about the ADLs, their basic activities, how they did. So, for instance, family member comes in and says, "How did mom eat this morning?" Well, you know the answer to that. Tell them, "Well, they ate really well today." But if they came in and said, "Hey, I know mom had a chest x-ray yesterday. Do you know what the results are?" And you do know what the results are. But would you tell them? No. That's the kind of information the nurse is going to pass on. You can just talk about any of the ADLs that you performed with the resident. When a family comes to us and they express some concerns, and this could be about anything. Maybe they are concerned about how mom's doing. Maybe they don't understand the disease process and what the diagnosis that mom has. Well, we need to make sure that we listen very carefully to what they say, and then we need to act on it. And by acting on it, I mean we need to go and convey what the family has told us to the nurse. This is really important because a lot of times, they're going to talk with you a lot more than they're probably going to talk with me, because they're going to be in the room with mom maybe while you're doing care. And so they may just kind of start talking and start expressing some of those concerns. So listen to those and then just come and let the nurse know what's going on. Behaviors or communication between the resident and the family and the staff. Sometimes this can reflect some distress. And it can be, some examples of that is maybe the family is feeling guilty about putting mom in the facility. That is so common because I don't know about you guys, but I always told my mom, I'm never going to put you in a nursing home, because that's how we used to call them. And my mom died unexpectedly, so I never had to do anything like that. But I've worked with lots of families, and they feel really guilty, but they really are making the right decision, because a lot of times it's just too much for them at home, or it could be a safety issue. They're in the right spot. So we just need to reassure them, listen to them and reassure them. Sometimes the resident will express anger towards their family because they put them in there. They don't understand what's going on. especially if they're confused or have dementia. They might say, "Oh, you're just trying to steal my house and my money and my car." And that's really the disease talking. It's not the resident talking. So we need to really listen to those families that come in, and then again, talk to the nurse. Let them know what's going on, because we can get the social worker to go in there and spend some time and talk with them. But a lot of times the family doesn't understand the whole diagnosis that the resident has. They don't know what's going to happen next. So they're scared. So they just need some reassurance, and they need some education. So that would, as a nurse, that would be what I would do. The CNA should always avoid having family arguments or making decisions. We don't ever want to get involved in the family arguments or their decision making. That's theirs. Now, if we notice there's a conflict going on in the residence room between family members and that they're arguing and maybe that it's getting out of hand, please inform the nurse. We can go in there and kind of diffuse it, kind of help them out. We can get the social worker in there and she can help them. So again, good communication guidelines, courtesy, respect. Keep those emotions under control. Put yourself in that resident's position. Identify yourself. Provide opportunity for the residents to express their thoughts. Watch those and observe those nonverbal behaviors, not only the residents, but yourselves. Listen carefully. Focus on their concerns. Make sure you're aware of the residents and yourselves' barriers to communication. Now, as far as directions and personal responsibilities for competencies, the CNA is responsible for making sure that they understand their assignments that have been made and the directions that are given with them. If a CNA has not been trained on an assigned task, you need to say so. You need to be responsible for yourself. Don't go do it. If it's not within your job description, don't do it. Because, like we've talked about earlier in the units, you can be held responsible if something happens. Now, when reporting information to your nurse, well, you are my eyes, my ears, my nose, my touch. You are all of my senses. Because I'm just one person, probably taking care of at least 30 residents. There's no way I can go and do a full assessment on every one of my residents. So that's why I have you guys. And I'm very blessed. I'm very glad to have you. Because you guys are what I need out there, looking and feeling and smelling things that are going on with these residents. You'll be able to tell me when their condition changes. An example, maybe you were repositioning a resident and you saw a red spot on them. Well, I need to know that. Or maybe you're emptying their Foley catheter bag and their urine smells really foul. They might be getting a UTI. I need to know that. So you need to share that information. Also, you need to look for situations that could cause a resident harm. Maybe there is some cords in the room and they're just all over the place because maybe they're getting IV fluids, they have an IV pump, then they have a cord to the concentrator which gives you oxygen. Maybe it's just too crowded. So maybe we need to go in there and take some stuff out and rearrange things and put them into different plugs so they don't trip over them. So reporting any change, whether it's an improvement or a decline, we need the positive and the negative. So if we notice that they are really, really doing well, maybe we need to set bigger goals for them. Or maybe they're declining. Maybe they won't get up out of bed anymore. Maybe they can't. Maybe yesterday they could wash their face, but now today they can't move that arm. Those are things that I need to know. Personal information about yourself as a CNA, it shouldn't interfere with your performance at work. You shouldn't share any personal information with the resident. And by personal information, I mean Like I was talking earlier, I don't have enough money at the end of the week to get to work. I don't have enough gas. Those are the things you don't want to share with them. But you do kind of have to get to know them kind of a little bit, and they need to get to know you. So you share positive things. So you might tell them, well, I just got my CNA and I am working towards my nursing degree, if that's what you're doing. Or maybe you're doing something else in school. Share that kind of things with them. They might ask you, how many children do you have? You can tell them that. Tell them, I have 3 boys, or I have 2 boys and 1 girl. That gives you some things to talk about and communicate about. Residents, they will tell you, and they will complain to you. They're going to tell you things that maybe the CNA did last night. Or maybe their visitors picked up on something that somebody else did. Any complaints, they need to be directed and reported to the nurse. Okay, so any change in the resident, whether it's good or bad, any complaints or concerns, just take them right to the nurse and let them take care of it. Now we're going to talk a little bit about answering call lights. I have to tell you this little story real quick. One time I was visiting a long-term care facility and I was in the physical therapy room, and I had a couple of students with me and we were walking around, and one of the residents saw me and she asked me who I was, and I told her I was an instructor, and she said to me, "Oh, can I tell you something, please?" And I said, "Sure." She said to me, "Will you tell your students that when they come into my room or come into anybody's room and the call light's on, not to just come in there, turn off the call light and walk back out?" I thought, wow. She says, "I know that the CNAs are really busy, so I want to suggest this. How about come into my room, you can turn off my call light, then you can ask me what I need, and if you can't help me right then, can you just tell me that you'll be back as soon as possible and not forget about me?" And I said, "Sure." So I wanted to share that little story with you because that really kind of really touched me. I really felt bad. So answer those call lights as soon as possible, because that's their only way for them to communicate with us. That's their way of telling us they need something. And so that we need to answer them promptly. So the best way to do it is when you walk in, when you knock on the door, you introduce yourself, you say your job title, go right to the wall, and there's usually a little button, and you push it and it turns off the call light system. Then you can talk with your resident and see what they need. Now, the next thing you need to do is, if you happen to move that call light, you need to make sure that it's back in the reach of the resident. Because again, that's their lifeline. That's the only way that they have to get a hold of you. So a good thing to start to get in a habit of doing is, after you finish taking care of what the resident needs, just don't forget to turn off that call light. But before you leave, you need to ask the resident if there's anything else they need. Make sure that they're comfortable. Offer them a drink of water. But when you leave, go to the door, turn around, and just do a little survey. Did I turn off the call light? Did I put the call light back into their reach so that they could get to it? And then you might ask them one more time, is there anything else that I can do for you before I leave? Another form of communication we're going to talk about is answering the telephone at a facility, or the intercom or cell phone. When answering a telephone at a facility, you need to identify yourself by name and job title, and of course the company that you're working with. Always speak slowly and clearly. When taking a message, make sure that you write it down. Ask for any spelling if you need it, because I'm a terrible speller. I could probably misspell Smith. Then you need to repeat the message back, and verify the caller's information and phone number and name. Always remember when using the phone, confidentiality. We never give any information over the phone, and the reason why is because we don't really know who's on that other end. They could say that they're, Mrs. Smith's daughter, and it may not be. It might be their friend. So we can never give any information over the phone. Now, when we're communicating with a resident with any kind of vision or hearing impairment, we need to always approach them within their field of vision. So, for instance, if you know that a resident is maybe totally blind in their right eye, you would never approach them from the right side. You're going to always want to come to the left side. In some diseases, they lose partial vision. Some of them will only have the center vision. Some of them will only have the peripheral vision. It's very important that we know their visual field so that we can approach them from that field. Always get on the same level. If they're sitting or standing, we should be at the level of the resident. That way we have good eye contact. When speaking with a resident that's impaired, make sure you speak slowly and clearly and use a low-pitched voice. And the reason why is if they can't hear very well, maybe they have some hearing, they're going to try to read your lips. So that's why you need to speak real slow and clear. Using nonverbal communication to provide cues, well, one example would be like this. Maybe you are trying to get a resident to brush their teeth, and you hand them the toothbrush, and they just kind of look at it like, wow, am I supposed to comb my hair with this or what? They kind of have in their brain, you kind of know, but they just can't remember. So what you can do is take your hands and do the brushing up and down movement by your mouth. That will show them that that's what you're trying to get them to do. Now, as I spoke about earlier, if a resident wears glasses, please check to see that they are clean. Also, make sure that they properly are placed and that they fit. So, always look at their glasses. Are they way down at the end of the nose because they're all stretched out? Or maybe part of the lens is coming out and, it needs to be tightened. We need to check to see if they fit appropriately. With hearing aids, same thing. If a resident has hearing aids, we need to make sure and check to make sure they're properly placed in the right place. We need to make sure that there's batteries in them and that they're turned on. You should always report any kind of device that is not working correctly. And again, if a resident is having difficulty hearing and maybe they don't have a hearing aid, then we need to report that to the nurse. Maybe that's something we need to check into. Maybe we need to get their hearing screened. When we are maybe assisting a resident to bed at nighttime, we need to make sure anytime that we store the glasses and the hearing aids back into the container where they go. Also, make sure that their name is on them. With glasses, we can put their name on the arm of the glasses. Because a lot of times they'll go and they'll do something and then they'll just put them down and they'll walk away. And if you have 2 or 3 people do that, because if you have 60 residents in a facility, that can easily happen, and we have 3 pairs of glasses and no names on them, then we're going to have to go try to figure out whose are whose. So it's best just to have their name in them. With hearing aids, there's usually it's hard to find out who belongs to who with the hearing aids, but there are ways that we can identify hearing aids to certain residents. But please do always make sure that we get the hearing aids and glasses back into their cases. Also, when checking laundry, after you help a resident to undress, it's really good to get into a habit of checking their pockets, because sometimes they'll stick their glasses or their hearing aids in there. And I've even found hearing aids wrapped up in Kleenex or a napkin and in a resident's pocket. So if there's napkins or Kleenexes in there, you really should look in there to make sure the hearing aids aren't in there. Now we're going to talk a little bit about identifying behaviors that are often shown by residents who are confused. You're going to have residents that are not able to do any self-care. They've lost the complete ability to care for themselves. And then you're going to have some residents that are unable to recognize familiar people or even their surroundings. These people really are going to take a lot more of your time, and you need to be patient and calm with them, because the more, if you show that you're anxious or even scared of them, they're going to be able to feel that. So the best way to handle this is to stay calm and to just reassure them who you are and where they're at. They also, a lot of elderly people have memory loss. And some of this memory loss could be of particular events, even most of the time it's recent events or experiences that have happened to them. They also have impaired judgment, especially when it comes to safety. Say you have a resident that needs assistance times one person to go to the bathroom because maybe their balance isn't real good. And so they put on their call light and they have to go to the bathroom. Well, they kind of expect and hope that as soon as they put their call light on, that you're going to be right there. I know sometimes that's not going to be able to happen. So they might try to get up and go to the bathroom by themselves. And that's because they have impaired judgment. They forget about the safety. So we need to be aware of these kind of behaviors by confused residents, because safety is a big issue. We don't want them to fall, and we don't want them to hurt themselves. So just kind of going over some things that we learned in this unit. Approach the resident from their field of vision. We got to know their field of vision. Can they see directly in front of us, or directly in front of them, or they only have the peripheral side vision? Always speak calm and in a friendly manner. Avoid sudden or loud actions because that can startle them. Use simple words and sentences. Always offer simple choices. Instead of pulling out 4 sets of clothes to see if they would like to wear one of those, try just bringing out 2 of them. If a resident doesn't understand a spoken request, try demonstrating them. Kind of like my example when I said you handed a resident a toothbrush and they kind of looked at it, really didn't know what to do with it. Or maybe they even started combing their hair with it. What you can do is just to take your hand and kind of demonstrate by bringing it up to your mouth and going up and down like you were brushing your teeth. Follow a consistent routine. As we get older, we like things to be consistent. We like routines, and they're in routines. So we need to kind of try to stay with a consistent routine. If a resident is unwilling to participate in care activity, never force them. They have the right to refuse. Remember, these residents have rights, and we must respect them. Arguing with a confused resident is ineffective. Never argue with a confused resident. You're not going to win. And that's not about winning. It's about communicating. It's about respect. Use distraction techniques. A good example of a distraction technique is maybe I'm trying to assist a resident to get out of bed and he's just not really, willing at all, and he's not participating with me and he's kind of fighting me. So maybe I know that he used to be a boxer and there's an award on the wall that talks about that. I might start talking to him about that. I might just say, hey, tell me some more about when you won that fight. They love to share their stories. So use distraction. And by distraction, you're going to be able to do all kinds of things with them. And that's why it's important. It's kind of like continuity of care. It's good for you to stay with the same residents, because the more we learn about them, the more that we're going to be able to use that to distract them and help them to achieve all of their ADLs by just talking about their life. Well, guess what? You've completed Unit 4. You've done a great job. Keep it up. Just remember, it's all about the residents.